pleasure to extend a warm welcome on behalf of our organizers. We consider it a great honor to welcome Dr. Shanti Sri Pandit, Honorable VC JNU, on the stage and request Dr. Anil Gupta, HOD of Projects, NIDM, Shri Tukaram Naik, Secretary, RSS Janakalyan. Rightly so. Resilience is about how quickly systems can ensure the return to normal life. Resilience is built in the times between one disaster and another. Studying past disasters and learning lessons from them is the way. With these path-breaking words, we are assembled here for the conference.
Thank you. Honorable VC Shanti ma'am, Jain ma'am, respected Adarniya Shri Bhansali ji, respected Gupta ji. I am representing RSS Janakalyan Samiti, who is one of the sponsors of all this project. And there may be curiosity among all the audience that exactly what RSS Janakalyan Samiti stands for. I would like to brief it in a few words that this is an organization floated by RSS itself. Rather, it is the RSS organization which is working in the field of social service, Samaj Sewa. During those days, RSS had no wing of Sewa within itself, so there has to be a need was felt to institutionalize a body which can face the problems in the field of social service. It started with the menace of famine during 1972-73 in Maharashtra. It worked there and it got done various relief works in those days, and then it was registered as a charitable trust in Maharashtra. As of now, this body is having presence in 58 districts of Maharashtra state, having 4,200 devoted workers. All these 4,200 devoted workers are unpaid. They are volunteers in real terms, Swam Sevaks. Wherever there is any call by our organization, these Swam Sevaks come forward and they contribute to the cause of social service. Today, Janakalyan Samiti is having 1,860 smaller service units regularly working within the state of Maharashtra, and there are 9 big projects like hospitals, like blood banks, a residential school, then a facility for multiply challenged children, and so on. Such type of facilities, such types of projects we are having, and it is working through 7 verticals, of which disaster management is the main. Wherever there is disaster, you might have seen that whenever there is any disaster, may it be a natural calamity or man-made any problem, within a shortest span, sunsets appear there. All over India, you must have seen. In Maharashtra, it is done through the RSS Janakalyan Samiti. To name a few disasters, that Killari earthquake, which devastated human life there, then Bhuj earthquake, then Kerala flood, Andhra flood, and even during the Nepal earthquake also, Janakalyan Samiti helped a lot to the people. Sorry. So, disaster management is one of the main objects of the Janakalyan Samiti, And we are very much trained in the field of disaster management, relief work. During 2020, what we have witnessed in the form of COVID-19, we had to face a very dreadful menace, which was the enemy was invisible and the spread was global. In the initial days, Janakalyan Samiti worked in a systematic manner. As you know, on the 25th March 2020, the Prime Minister of India addressed all Indians, and gave the idea of dreadfulness of this menace, and then onwards the lockdown was also declared. Nobody knew what to do because the enemy was invisible, and the remedial measures were also not known. But human being is a striving community. They come with some ideas and someone has to initiate that. In Maharashtra, Janakalyan Samiti
and the other NGOs also. Honorable Minister has arrived, and we will. We consider it a great honor to have Dr. Jitendra Singh, Honorable Minister of State, Earth Sciences and Science and Technology, with us. We will start this session by lighting of lamp. I request Honorable Sir Dr. Jitendra Singh, Dr. Shanti Shri Pandit, Dr. Anil Gupta, Dr. Pallavi Jain, Shri Pannalal Bansari and Shri Mahesh Ponerkar to light the lamp. I would now request Honorable VC Dr. Shanti Shri Pandit to welcome and facilitate Dr. Jitendra Singh by presenting him Tulsi sapling, a book and a memento. We request ma'am to further facilitate Dr. Pallavi Jain by presenting her Tulsi sapling and memento. I would like her to also facilitate Shri Pannalal Bansali by presenting him Tulsi sapling and memento. I now request Shri Tukaram Naik to welcome and facilitate Dr. Shanti Shri Pandit by presenting her a tulsi sapling and memento. Now I request Shri Pandal Bansali to welcome and facilitate Dr. Anil Gupta by presenting him a tulsi sapling and memento. I would like to call Dr. Deep Narayan Pandey to welcome and facilitate Shri Tukaram Naik by presenting him tulsi sapling and memento. Now I would request Shri Mahesh Ponerkar to begin this session with the introductory remarks.
नमस्कार। आज के कार्यक्रम में उपस्थित माननीय मंत्री जी डॉक्टर जितेंद्र सिंह जी, जेएनयू की ऑनरेबल वाइस चांसलर शांतिश्री पंडित मैडम, राष्ट्रीय सेवा भारती के अध्यक्ष भंसाली जी, डॉक्टर अनिल गुप्ता जी, तुकाराम जी नाइक जी और डॉक्टर पल्लवी जैन, आप सभी का मैं इस नेशनल कॉन्फ्रेंस रिगार्डिंग डिजास्टर मैनेजमेंट में स्वागत करता हूं। और यहां पर उपस्थित सभी देश भर से आए हुए गणमान्य व्यक्ति, प्रोफेसर्स, डॉक्टर्स और जेएनयू के छात्र, सबका मैं यहां पर स्वागत करता हूं। आज का एक विशेष कार्यक्रम है जिसमें केयर इस प्रोजेक्ट के अंतर्गत पश्चिम महाराष्ट्र में पैंडेमिक के दौरान जो काम हुआ, उस काम का जो सोशल रिसर्च किया गया, उस सोशल रिसर्च का बुक पब्लिकेशन, केस स्टडी का बुक पब्लिकेशन माननीय मंत्री जी के हाथों से होने वाला है। उसी तरह जो 2 साल हमारे देश ने देखे, वैसे तो पूरे विश्व में पेंडेमिक था और उसकी जो मार थी सभी देशों में सभी जनता उसको झेल रही थी, लेकिन ऐसे वक्त भी हमारे देश में हमारी सरकार, हमारा एनजीओ सेक्टर और समाज, इन्होंने मिलकर जो काम खड़ा किया वो अतुलनीय था। और एक प्रकार से 100 साल के बाद ऐसा कोई डिजास्टर जब आता है तो उसमें किस प्रकार से समाज में खड़ा होना है, समाज ने खड़ा होना है, इसका एक अच्छा उदाहरण बहुत जगह देश में देखने को मिला। तो ऐसे उदाहरणों को और
I would now request Minister Dr. Jitendra Singh Ji to felicitate Dr. Pallavi Jain for her and Krishna Diagnostics' valuable contribution during the pandemic period. I would also request him to felicitate Dr. Sanjay Tambad by presenting him a memento and sapling as the editor of this book. Further also felicitate. Now we would like to invite Dr. Jitendra Singh, Honorable Minister of State, is independent in charge of the Ministry of Earth Sciences, Science and Technology, Minister of State in the Prime Minister's Office, Personal Public Grievances and Pensions, Department of Atomic Energy and Department of Space for enlightening us through his exquisite speech.
Honorable Vice Chancellor Professor Shanti Shri, राष्ट्रीय सेवा भारती के अध्यक्ष बंसाली जी, जन कल्याण समिति से नायक जी, डॉक्टर अनिल गुप्ता, डॉक्टर जैन whom you heard just now, यहाँ पर पधारे हुए सारे वरिष्ठ अतिथिगण, dear students. At the outset, I have to compliment the Vice Chancellor for organizing this event and giving me an opportunity to be once again over here with all of you and to sit beside her. She was very proudly saying that this is one of the best universities, one of the best faculties, one of the best students. But what she missed out to saying that is one of the best Vice Chancellors also. The gates of JNU were virtually unwelcome for many like me till few years back. The first time this gate opened when Dr. Jagdishan came in, but that was very reluctant, half welcome, half unwelcome. But I have seen this ever since Professor Shanti Shri has been taken over, it's virtually become a habit to be here every third day. But honestly speaking, one thing I miss out. I come here and I don't make news. So, till about 2015 or 16, even before the program, suppose the program was to take place in the afternoon or seminar or whatever, the protest would start in the morning. And all the channels would start reporting. So even without conducting the program, I would become famous all over. Now it's the other way around. So that is one complaint. But I don't mean that next time you stage manage a protest. Because you've been such a peaceful Vice Chancellor, or shall I say scary Vice Chancellor. I don't know whether these protests have stopped out of your peaceful demeanor or out of the fear of protesting. But both ways, we are thankful to you and we appreciate you. And it's the manner in which you have carried everybody along. Very nicely you said, excellence with equity. And I would add with equanimity as well, which is part of your behavior and conduct. Now as far as the subject this morning is concerned, सबसे पहले तो मुझे बधाई के पात्र हैं हमारे जितने भी इस ये जो पुस्तिका जिसका विमोचन हुआ है इसके रचना में जिन जिन का योगदान रहा है, एंड आई एम श्योर दिस इज गोइंग टू बी अ रेफरेंस बुक even for the future researchers and future scholars. And you have done a great contribution or putting on record some of the most turbulent times that we have gone through in the last few years. But one thing you must have realized, that India has such deep and strong inherent potential, इतनी प्रतिभा, इतनी योग्यता, इतनी क्षमता और परिश्रम करने का मादा. We just need an opportunity. So when we are challenged with a challenge, our hidden capacities come out. Now COVID struck out of blue to the whole world. Like anyone else, even India was unprepared. We didn't know what it is all about. Nobody had heard about COVID also. And when COVID did arrive, the whole world was apprehensive that India would become hotspot for the rest of the world. और सब 130 करोड़ की जनसंख्या, अपना आप संभाला नहीं जाता, सुबह भोजन करते हैं तो रात को उनको व्यवस्था नहीं है, तो ये भला इतनी महामारी कहाँ से संभालेंगे, उल्टा हमारे लिए भी एक चुनौती बन जाएंगे. But at the end of the day, our COVID management was more successful than even small European countries with just 500,000 population or 500 crore population. And that also, I think the credit most of all goes to Prime Minister Narendra Modi. बहुत पहले मुझे याद है जब 2020-19 के दिसंबर के मास में चीन से छुटपुट रिपोर्टें आने लगी, बहुत ज़्यादा लोगों को जानकारी नहीं थी.
Our sincere gratitude to SSV Honorable Minister Dr. Jitendra Singh ji for making today's program success. You are not only for boon for the Jammu and Kashmir, you are also for the nation and Modi government. आपने जो युवाओं को प्रेरणा दिया, जो आगे लक्ष्य दिया, वो बहुत ही सराहनीय है और हम लोगों के लिए सीखने के लायक है. और मैं heartfelt gratitude to इस यथा नाम तथा गुण, जैसा आपका नाम है वैसा ही अपने गुणों को भी सिद्ध करने वाली कुल गुरु ऑनरेबल डॉक्टर.
On their toes, they were doing a lot. They already had their own infrastructure, they already had a manpower, but of course that was not enough to tackle all this situation. So many NGOs were also coming forward. They had their own strategies, they had their own expertise, and they had a volunteer base. So NGOs were working parallelly, government bodies were working parallelly. They actually, there were people at individual levels, at voluntary levels, they were doing on their own, they were taking initiatives, they were providing food, they were providing medical aid, and there were a lot of people, like a large segment of our society was really afraid of the infection, and that is why they were feeling paralyzed, almost they were feeling paralyzed. And on the other hand, there were some people who fearlessly came forward, who rendered their service voluntarily. And in Pune, especially in Maharashtra, we all saw that government departments and NGOs, different kinds of other voluntary organizations, they came together, and in a public-private partnership, they have started many initiatives which had a lot of impact on different sectors of our society. So together they came together, and somehow in many aspects, like in case of in the sector of health, they started many initiatives together. In the sector of education especially, we could see a lot of new initiatives taking place, and which could be cited as a role model. Because we, after the pandemic, when we thought about and we surveyed about all the kind of efforts which were done, through that survey, many major role models came forward, and we thought that these role models have to be cited somewhere, it has to be documented somewhere, because after all, why, as a social scientist, how we and why we do research, it's the purpose behind our research is always to help the society. The findings of our research should be helpful somewhere for our society to improve the
Interactive sessions. So I will hand over the session to Mrs. Nivedita Chitnis. As these are the interactive sessions, the mic will be circulated among the.
Good afternoon, ladies and gentlemen. My name is Nivedita. So me and myself and Mr. Krishna Kumarji would be hosting this event for next 1 hour.
गुड मॉर्निंग लेडीज एंड जेंटलमैन. अभी मंच पर विराजमान हमारे आदरणीय श्री पन्नालाल जी भंसाली मूलतः मेघालय के तूरा के रहने वाले हैं. हमारे बीच हमारे दूसरे मार्गदर्शक पाथेय सुश्री बीना बंदोपाध्याय जी से मिलेगा, जो राजनीति विज्ञान में मास्टर डिग्री के साथ ही लोक प्रशासन तथा प्रबंधन में बनारस हिंदू विश्वविद्यालय से पीजी डिप्लोमा की डिग्री भी हासिल की है. सुश्री
फैसिलिटेट मिसेस बीना बंदोपाध्याय.
Good afternoon, everybody, and very warm welcome to all of you. First of all, by the time PPT setups, you see the technology also is sometimes becomes very limiting. So I'm a student of political science from, and as mentioned earlier, and passed out. I did my master's from Banaras Hindu University in when in 1990. So it's quite. I'm quite old in terms of the kind of audience. You all are quite young as compared to. And first of all, I would like to say, and the response, which is very critical, is that any disaster in any normal provide a response to everyone, especially the poor, in terms of protecting them from poverty, vulnerability, and social exclusion. So it is not possible by only government, it is not possible by only civil society organization, it is not possible by some academic research, and each one of us have the role to play to see that we do whatever is possible to protect the children and families and our future generation to be able to realize their full potential. A girl child due to negative coping mechanism is not vulnerable to early marriage. Because of the disaster situation, pandemic situation and economic stress, there is child which is not dropping out. Because of certain situations, there are not other negative coping mechanisms that women are subjected to, such as credit and things which brings additional vulnerabilities. So, where is that? Okay. So, my lecture is now going to start from there. So, the thing is that the whole issue is that we have to have a very holistic approach, especially when disaster or emergency of this scale starts. You will handle it? Okay, go to next. So, since we were talking, sir, you sit here, absolutely no problem. So, we were talking about the topic of this conference is about methodologies. What are the methodologies that responds to pandemic? And in researchers' mind, methodologies are usually research methodologies, but here the meaning of methodology is the way you address, the way you respond to pandemic. So, social protection is a policy instrument of the government that is capable, and that is what is used globally and including in India to respond to any disaster, pandemic, which is natural, and other disaster, to respond to situation. Rights are equal. We all have rights as a human being, as citizens of India, as a child, as a woman, but circumstances are very different. And circumstances make all the difference. The ability to cope somebody in urban area and somebody in rural area in any distress will be very, very different. So, so how you realize your rights are circumstantial. So what social protection does to enable the communities, to enable the families, to enable the young population and girls and boys and families to respond to those vulnerabilities during the disaster or emergency situation. So there are, you see increasingly there are number of disasters. I'm not going to more on disaster because there are lots of experts and people who have worked on from community perspective in disaster. So there are increasing disasters and shocks and emergencies, starting from war in Ukraine to conflict, to price rise, to floods and droughts, India, globally, earthquake in Turkey and Syria, and other kinds of conflicts which are going on. So all these are going to affect not only because we are living in global world. Nobody, not in today's world, we are not living in isolation. So anything happening in any part of the world, war in Ukraine will affect price rise in India and food inflation and everything. So we have to see from that perspective the kind of risk and vulnerabilities that it can bring to our own and opportunity that it brings to us. Effective social protection is very, so what is social protection? I will come and I'm sure you all know, but effective social protection support is critical in determining whether the children can, we are especially talking about children, can return to normalcy. And if it is weak, then millions and billions of children will never be able to return to their life path. The child or girl that got married because the family was poor, even one, will not be having the different chance to live the normal life. Similarly, a child which dropped out may not be able to go back for various reasons, may be able to go back, but chances are both equal, can go and cannot go. So effective social protection protects children and their families not to go to that path. Social protection is a set of public policy and program instrument that aims to protecting all kinds of people against poverty, vulnerability. India has one of the largest social protection program in terms of public rural employment guarantee scheme, which also has many provisions, and it is right to employment. It has the oldest, one of the largest public distribution system, another social protection program. So what is social protection? That ranges from cash transfer for preventing girl-child marriage to food transfer of food to many other, I think I'm audible. So many other things. Can we go to next? Yes. So, SOC responsive social protection is also a global commitment to that every citizen and every child has a right to social protection. And Sustainable Development Goal 1, which is related to poverty eradication, and 10 focuses on many countries, all middle and low income countries are increasingly prioritizing their resource allocation for this scheme. And in case of India, you would have seen Pradhan Mantri Gramin Kalyan Yojana, PMGKY, Garib Kalyan Yojana, and then Annapurna Yojana. These are few examples how India has expanded its huge basket of social protection to respond to the pandemic and to minimize the stress and shocks on migrants and poor and rural families. Can we go? So vulnerabilities may differ. It will be different at the life cycle course. If you are a child, if you are a young girl, you are a woman, you are a man, you are an earning member, these vulnerability dimensions can differ. In terms of the way UNICEF defines is, there are social economic vulnerabilities. People are socially vulnerable due to their caste, creed, religion, certain practices, gender, disability. So there are social vulnerability that restricts them to take the benefit of policies and programs that are in place. There are economic vulnerability such as pandemic, millions and billions of people left cities because of the lockdown, went to poor, to their rural home, which did not only cause the loss of job, but when they went back, the burden on women to look after them, and also economic stress and other vulnerabilities that, and I don't need to go in detail, and you know all about the migrant crisis that India faced. So economic vulnerability is sudden shock to which causes your loss of income and livelihood. Children, families being custodian of children, and we all have been young, you have reached here because your parents have been able to invest in you to bring you up to here. I'm standing here because somebody in my family worked hard to make sure that I have some level of education and reach some level. So families, communities, and government in particular, state has obligation to ensure that all children reach to their full potential with their health, education, nutrition, and all the rights and provisions are there to utilize. Can we go to the next? So what UNICEF is doing globally and including in India, the first is that strategic plan, which is usually 5 to 6 years. We are obligated and have committed to ourselves that children have access to inclusive social protection, that is live free from poverty. So child poverty, the way we use, is not the poverty of adult, but any deprivation a child is facing in terms of basic services, health, education, nutrition, is that can be defined or termed as a child poverty, because child is either deprived of one or multiple factor. So that is one thing that children do live the life without deprivation, discrimination, and poverty. Other is our commitment to risk informed. So all social protection programs have to be risk informed, risk resilient, such as During COVID time, you saw the expansion of PDS with Annapurna Yojana or expansion of NREGS with
Dr. Sanjay Rai. Krishna Kumar ji would introduce Dr. Sanjay Rai.
हम लोग डॉक्टर संजय राय जी का तालियां बजाकर स्वागत करें। इनकी खास विशेषता मैं अंत में बताऊंगा। आपने जीएसबीएम मेडिकल कॉलेज कानपुर से एमबीबीएस तथा बीएचयू स्थित इंस्टीट्यूट ऑफ मेडिकल साइंस से कम्युनिटी मेडिसिन में पोस्ट ग्रेजुएशन की उपाधि हासिल की है। वर्तमान में आप एम्स में कम्युनिटी मेडिसिन विषय के प्रोफेसर हैं तथा भारत सरकार के इम्पावर्ड प्रोग्राम कमिटी के नॉन ऑफिशियल मेंबर हैं। ये एक रेयर अपॉर्चुनिटी भारत सरकार ने स्पेशली सर को दिया है। लगभग 200 प्रकाशन इनके हैं और 40 शोध कार्यक्रमों का इन्होंने निर्देशन किया है। विगत कोरोना काल में इनका अद्भुत एक योगदान रहा है। पूरे 3 साल में कोरोना काल के दौरान हम लोगों के कोवैक्सीन की पूरी दुनिया में तारीफ हुई। उस कोवैक्सीन का फेज 1, फेज 2 और फेज 3 तीनों फेज में कोवैक्सीन बूस्टर डोज ट्रायल, कोवैक्सीन सेफ्टी एंड इम्यूनोलॉजिसिटी की और चिल्ड्रन एंड कोविड नेजल वैक्सीन ट्रायल के क्लिनिकल ट्रायल्स में प्रिंसिपल इन्वेस्टिगेटर की भूमिका निभाई और इन्हीं की बदौलत पूरे हिंदुस्तान में कोविड से जो सुरक्षा प्रदान हम लोगों की हुई, उस सुरक्षा के लिए हम सब सर के बहुत ही शुक्रगुजार हैं। धन्यवाद सर, आपके प्रेजेंटेशन का इंतजार कर रहे हैं।
Thank you very much. Namaskar, all the dignitaries, brothers and sisters, friends. First of all, I would like to thank organizers for giving me this opportunity, especially Sewa, Bharati and Shri Krishna Kumar ji. I have been asked to speak on this COVID-19 vaccination strategies, success and challenges. So there are a lot of challenges. We have demonstrated success, but we are facing a lot of challenges. So this virus, SARS-CoV-2 is 3 years old virus now, and we have generated lot of evidences throughout the world. In last 3 years, I don't recall for any other disease in this short period of time, 2 to 3 years, this type of evidence ever generated in the past. So lot of evidences, more than 100 papers coming in peer-reviewed journal, in high-impact journals per day since last almost more than 2 years. So there are a lot of evidences. So what I will do, I will only discuss here what are evidences we have. Based on the evidences, what are the success and what are the challenges we had. So this is the strategies, success, challenges. This is the current strategy. Universal vaccination for more than 6 months of children in many parts of the world. In this country, more than 12 years. For everybody is eligible for universal vaccination. With this premise that vaccine will prevent infection. So that's why everybody must get vaccine. Unvaccinated people are at risk to the society. नहीं लिया तो उन्होंने पूरी सोसाइटी के लिए वह जो है एंटी सोशल है. If this is the premise. Why universal vaccination? We recommended, by we means various UN agencies and other government recommended based on these premise. Vaccination against COVID will prevent future waves. So that's why you must take 2 doses of vaccine. You must take this booster dose or precautionary dose, 3rd, 4th, 5th, 10th booster, whatever. This is the current strategy. Vaccinate all children before sending to school. Although children, the premises in children, this COVID is not serious, but they may bring infection and they may infect others in the family. So that's why vaccinate children. And contact tracing, I'm not going to discuss this contact tracing. So, but we have lot of challenges also, like reinfection. Those who had past infection, again developing infection, we call reinfection. Breakthrough infection, we have clear-cut definition of breakthrough infection. Like if you are fully vaccinated and 2 weeks after vaccination, suppose if say 2 dose vaccine, majority of vaccines are of 2 dose. So if you are developing infection, getting infection, we call this breakthrough infection. So we have clear-cut definition of breakthrough infection or reinfection. So does COVID vaccination prevent infection? We will discuss this. Does COVID vaccine prevent hospitalization and death recovered? If yes, it's a great success. If no, then it's a failure. Does COVID vaccination prevent long COVID? Currently we are discussing long COVID. If yes, yeah. As a scientist, I may say that may increase also. It's because of your hyperimmune response. So we'll discuss all this, the evidences we generated till date. And the future course of pandemic will depend upon your community level immunity. We know we have generated immunity through 2 ways, and both are acquired immunity. One is through vaccination, another one is through natural infection. We have advantages and disadvantages of both, strength and limitations of both. This is the current situation. I am using this particular slide since last almost 3 years. So currently more than 68 crore what has reported more than 68 crore cases. These are the actual reported number. Actual number could be several times higher, 20 to 30 times higher than this number. And then almost 6.8 million deaths. So 68 lakh deaths this world has reported till date. This is the reported number. Again, actual number could be several times higher. And see, this virus SARS-CoV-2 traveled to more than 200 countries within 3 months of reporting. First time reported in the Wuhan, you must be aware, in December 2019, and then within 3 months, by March 2020, almost traveled to more than 200 countries. So entire was in our country also, this is the situation. The big question is the end of the pandemic. Yes, we had several pandemic in the past. We said goodbye to them also. We will say goodbye to this also through community level immunity. So I am not going to cover this. We know vaccination, and I am coming to the main topic, vaccination. I have only 15 minutes time, so I will go fast, 15 to 20 minutes. Vaccines, other than COVID vaccines, we have many other vaccines, and it's estimated that we are saving almost 30 lakhs life per year through the various vaccine preventable diseases. So using various vaccine. So there are vaccines, we are using more than 20 type of vaccines. Even for the COVID now we have vaccine. We will discuss how many vaccines we have. 37 vaccines we have, so we will discuss this. So we develop immunity either through natural infection or through vaccination. Actually, almost all these vaccines work on the principle of natural infection. So there are many diseases we have already controlled, like we have already eradicated smallpox. Smallpox was really a serious problem almost 30-40 years ago, but last case was not more than 50 years ago. 78, after 1978, we are not seeing any cases. There was a high mortality, but finally we said goodbye, and through this vaccination program, we had very good vaccine. Polio, almost we have controlled polio, we have eliminated, although we have not eradicated, but eliminated from this region. Many parts of the world, only 2 countries are now endemic, Pakistan and Afghanistan. Chicken pox, and all these provides lifelong immunity after one infection. Like polio, after one infection with the same variant. There are 3 variants of polio. So with same variant provide lifelong immunity. Measles provide lifelong immunity after natural infection. We have vaccine against measles also. Single shot may provide lifelong immunity. Smallpox, lifelong immunity after natural infection. Chicken pox, lifelong immunity after natural infection. COVID, big question mark. Is it lifelong or not after infection or after vaccination? This is the current situation of COVID vaccine. For many diseases, either polio, measles, we have 1 vaccines. For COVID-19, already we have approved 37 vaccines by the various regulatory authority of this world. So we are using 37 types of, they are using different type of platform, so the different technology. More than 300 vaccines are in the different phases of the development. Still around 200 are in the preclinical stage before entering the clinical stage. So lot of these manufacturers, they have lot of hope. This is the current situation. We have already used more than 13 billion doses. 70% of the world population has received at least 1 dose of the COVID vaccine. India, we have used more than 200 crores. So this is the situation. These are the various vaccines. I am not going to discuss, but co-vaccine I can discuss. This vaccine was developed here, so completely indigenous vaccine. Krish Kumarji mentioned that I was the principal investigator at AIIMS, New Delhi, for all phases of the trial. So co-vaccine was developed here. It's using different platform. Whole virion kill, उस वायरस को किल करके ही हम देते हैं. So it's a different platform. Covishield, using different platform. They are using vector adenovirus as a vector. Sputnik, they are also using adenovirus. The difference is co-vaccine is using, Covishield is using chimpanzee adenovirus, whereas Sputnik is using as a vehicle human adenovirus. So there are the various platforms. Some are using messenger RNA, like Pfizer, Moderna, they are using messenger RNA. So the entirely different technique. So all these vaccines are using different technology. It's not the same technology. It's not only that names are different. So they are using various technology. Some are using DNA technology, RNA technology, etc. These are the various vaccines approved in the India, so I'm not going to discuss this. These are the reported efficacy of these vaccines published in high impact journal, like we also published in the Lancet our clinical trial data. So all vaccines are very effective in preventing severity and death. None of these vaccines clinical trials were designed to address infection. None of the clinical trials. But we used this data. The trial was designed to address severity and deaths. So almost all vaccines are capable of preventing severity and death in susceptible population. The catch here is susceptible population. These are the vaccines approved by WHO. Not all 37 vaccines approved by WHO, but these are the vaccines already approved by WHO. So these vaccines are no doubt very effective in preventing almost 80 to 90%. They are preventing severity and deaths in susceptible population. The overall mortality of case fatality rate was around 1.5%. Like per million, there were around 15,000 deaths. हर 10 लाख में 15,000 लोग मर रहे थे. So there were 15,000 deaths when the entire population was susceptible. all these vaccines were capable of, majority of the vaccines, not I can't say all, but majority of vaccines are capable of reducing your severity and deaths up to 80 to 90%. That means around 13 to 14,000 life we can save per million. If per million infections are happening, symptomatic infections in a susceptible population, जब तक किसी को susceptible तब कहते हैं कोई, that means they don't have any immunity, या तो इन्फेक्शन नहीं हुआ हो या वैक्सीन नहीं लिया हो. So whenever I am saying susceptible population, that means never had COVID or never vaccinated. क्योंकि मैं बार बार इसको यूज करूंगा, so ये क्लियर होना चाहिए कि what is the meaning of susceptible population. So if you see, but there are some serious side effect of these vaccines also. Almost all messenger RNA vaccine, they are causing cardiac problem. Some vaccines like this Covishield, some clotting. But if you compare the risk and benefit, almost it's 10, somewhere between 10 to 50 cardiac problem or for all these vaccines. Serious adverse event. I'm not talking about the mild event. I'm talking about the serious adverse event following immunization. So they are causing some problem, but
childhood time also during my school, we also have some of the vaccinations, and then vaccinations has given us the protection as on today. So coming time is serious, in spite of not, I try to make it a very simple.
Following it up with the concluding session as well, I request Professor Dr. P.K. Joshi sir and also Shri Manoj Potsat and Professor Anil Gupta sir on the dais. Please, please. This national conference is happening in JNU today on 12th of April. And yesterday there was birth centenary of Mahatma Phule, and on the 14th we will be celebrating birth centenary of Bharat Ratna Dr. Babasaheb Ambedkar. Both these great persons have contributed to our society and social ethos, national ethos in multiple ways. And when we are discussing in this national conference about response of the government and the society to a disaster like COVID pandemic, how they also provide us maybe a perspective and outlook to face certain situations. And we may also remember Savitribai Phule, wife of Mahatma Ji Phule, who started first school for women in India. When there was plague in India in 1897, she was serving the people, going to various places, helping them, and their adopted son was also very much involved in this work. And when she was contacted with the disease, she also sacrificed her life into this. So societal response to such pandemic and disaster situations is there, and people are very much leading from the front, and they drive certain initiative to overcome all these hurdles. And that exactly is the theme of present session, lowering the impact of pandemic in the socio-economic sector through government voluntary partnership model. And Professor Dr. P.K. Joshi sir will be chairing this session. He is faculty in School of Environmental Science and also chairperson of Special Center for Disaster Research in this very prestigious university, Jawaharlal Nehru University. And the first speaker this session is Shri Manoj Pochat. He is Chief Operating Officer and co-founder of Sewa Infotech Private Limited, and he is also a member of Rashtriya Swayamsevak Sangh Pune Mahanagar Karyakarni and Pune Platform for COVID Response. That is a very coordinated effort in organizing various activities related to COVID pandemic and providing relief to the people in living like the metros in Pune and other area. So he will first have his presentation and it will be followed by some question answer session. Then second speaker in this session is Professor Dr. Anil Gupta. He has his Master's and MPhil degree in Environmental Biology and Health, and his areas of specialization are risk and vulnerability analysis, housing safety, local emergency preparedness, disaster management, planning and governance. And he is at present heading Center for Excellence on Climate Resilience and Center for Disaster and Health at National Institute of Disaster Management, and he is also coordinator of Technical Advisory Committee of National Institute of Disaster Management. So I now request Mahesh sir to felicitate our chairperson of this session, Dr. P.K. Joshi sir, on behalf of the organizers. And I request P.K. Joshi sir to welcome our two dignitaries, Manoj Pochat sir. And also Professor Dr. Anil Gupta sir. So first presentation will be by Manoj Pochat sir. I request him to deliver his lecture. Thank you.
Good afternoon, very warm welcome to all. Namaskar. I know it's difficult to sit in a AC auditorium after the amazing lunch. So I would in a way say that it's difficult for you all to make you sit here and obviously talks about a disaster which is not so a kind of limelight discussion, but it is important. That's why all of us are here gathered since morning talking about how the society came together, various case studies, success stories. So various speakers talk about it in multiple sessions before me. They elaborated different point of view, success stories in terms of vaccination, UNICEF, various other, and it was a very engaging sessions. I could see that participations from the students also, from disaster research institutes or disaster studies institutes. So the very overwhelming response from the students and the faculties. I'm here to talk about one of the case study, and this case study is unique in its approach. Why it's unique, I'm going to talk about why it's unique and what this case study has given to us. So when we talk about COVID pandemic, when it started in March 2020, so there were various, as we all know, there were various theories, were on the internet through, there were various, we know that there were various government also, we were talking about, the ones who actually, spread the virus. Then there are various discussions on the TV debate, there were various discussions, panel discussion, reports, where all of this were, coming up. And when all of this were coming up, society at large, how society pursue things. And it was about pandemic, it was about something which we don't know what will happen. And the society was also, in very disturbed and confused mode. Like, what will happen? Will we survive? Like, what are our chances to survive? So that, the discussion about probabilities, discussion of, survival, and that's why we see, that like various, including all the financial markets, stock exchange, everything was started collapsing. And that was the situation. So very few people, we all know, right? The government, the people, the counselor, they were, urging everyone to be positive, to, think positive. They were giving this, advices to everyone. And it was very difficult to be positive at that time. And this and why I'm talking about and why I'm, giving this background, because this case study, talks about that. So the PPCR, Pune Platform for COVID Response, started, with the same journey. During the pandemic, member of a civil society, people like us who were stuck in a lockdown, who wanted to help and support our people, doctors, community, and they thought of, coming together and supporting in a way with the resources they have. So this thought process came together, people came together and started, started a platform where they can support to our health worker who are in a front battle, through our government administrations who need resources, through our civil society or NGO who need resources also. So this Pune Platform for COVID Response was an integrated approach started by a civil society. We call it Government Volunteer Engagement Program, or we can call it Public-Private Partnership. So it is an integrated model. So in Pune, it started in Pune, where if you see more than 250 plus organizations, corporate organizations. So these companies like in Pune's top companies like Bajaj, Kirloskar and all of their heads also came together on the same platform. So integrate corporate companies came together. Then another sides we had more than 50 plus NGOs. The social services organizations. The social services organizations like RSS Janakalyan Samiti, other various social services organizations. Then the health and the hospitals. Hospital sectors, health sectors, they also came together because they also wanted some resource. They also wanted resources. They also wanted expert advice because it was not. So they could talk about health. They could talk about patient protocol. But what about fixing infrastructure issue at hospital in a stipulated time frame? So they need industry experts to help on that, not only in the form of resources. And the third is the government officers. So we had around, if we see the Pune and the Western Maharashtra, we had around various government agencies who has complete control on the COVID administration as per the Disaster Act. So who are they? The police commissioner, the police authority, the municipal commissioner, municipal authority, district collector, the food administrations, and all of these were part of the PPCR. So Pune Platform for COVID Response, it was a social integrations between corporate industry people, NGO, administrations, and the volunteer organizations. So this is multiplier effect, we call it, right? So everyone came together with one motto to help each other and society at large, to help patients, to help people who are in distress and need help. Next slide. So if we see what PPCR did in during that time, so PPCR as organizations could with the help of CSR could raise almost more than 200 crore rupees. So with the help of industry who came together, with the help of various CSR, the donors, individual donors, not only in India, the PPCR also got support from the international, funding partner like Temasek Foundations and others who also wanted to help. Because Pune was also, if you see that way, Pune was also epicenter of COVID during that time. So the number of cases, if you see news and media stories during that time, you will understand that the Pune has maximum number of patients, and the multiplier effect was huge in Pune as compared to the other cities. So the oxygen concentrators, the thousands of oxygen, 50,000 oxygen concentrator, HFNO, all these health equipments were supported, and they were airlifted from various cities across globe. So they were airlifted from Singapore, they were airlifted from Taiwan. So various countries where we could find the resources with the help of the corporate connects. So as we all know, that corporate has a deep connect, they have a negotiation power, they have a network of a people, they have offices across globe. So their offices which are there in other countries, they could find out where I can get the pulse oximeter. So if you remember, we were all it was difficult to, so COVID, how to identify a COVID patient. So COVID patients, there were COVID symptoms. Apart, one of the major symptom was this pulse oximeter. What is it? That because that patients will severely require oxygen if if it is below certain range. So the pulse oximeters, getting that lakhs of pulse oximeters from various countries. So these were the integrated with the help of industry. But then how do you get that? You need a government support. So you need a support from the Ministry of Civil Aviation. You need a support from the air freight or cargo companies. You need a logistics partner. So the Amazon of the world, they also came in support to airlift those. So that was the integrated last mile delivery in a social service area of those resources which are badly required for the hospital. So basically PPCR was the interface between all these as a front-end organizations. PPCR was just a non-registered platform. When it started, it was not even registered as a charity organizations or as a trust. So PPCR was a non-registered entity. It started with few people in Maratha Chamber of Commerce from Pune, and then the few civic society NGO members like the RSS Janakalyan Samiti was also become part of it. So if you see, we were talking about various case study which were presented by Janakalyan Samiti, like COVID screening program, COVID care centers, cremation services, then the screening at the in the slums and the interiors, even the food distributions, the food grain kit distributions, last mile supports, volunteer engagements, hospital supports. All these were done by the resources which were provided through the PPCR. So PPCR makes sure that the volunteer organization, the social service project, the NGOs who are working in this domain, they don't run out of the resources, they don't run out of the money, or they don't run out of the resources for example PPE kit. So that time we were short of the PPE kit in the March 2020. The PPE kit were airlifted from China. So because they only had it that time, and we were like like PPE kit before that was not that the common items which is easily available. So this was a integrated interface between the society, between the administrations, between the government, and between the hospitals. Then the immediate response. So PPCR, because as I mentioned, because of the deep connect, it could respond to those challenges which the society had that time. So various challenges, as I talked about the challenges the hospital has. So for example, there were short of nursing staff in Pune or in various other cities. So PPCR could talk to the very
Thank you, sir. Thank you for your insightful lecture. Myself, Dr. Mishra from Shivaji College. Sir, मैं एक बात जानना चाह रहा था कि कोविड टाइम में कुछ आर्टिकल्स कहीं के छोटी स्टोरीज आई अबाउट नेचर डेफिसिट डिसऑर्डर, जो कि खास करके अर्बन एरियाज में कंसंट्रेटेड थी और बच्चों में थी. सब लोग रूम के अंदर लॉक थे, बाहर का एक्सेस बहुत कम था, दे ओनली डिजिटल कनेक्ट. तो उस समय बहुत सारे साइकोलॉजिकल डिसऑर्डर्स भी आए, स्पेशली जिसको टर्म किया इन लोगों ने नेचर डेफिसिट डिसऑर्डर. तो सर, अगर इस तरह की सिचुएशन अगर आगे भी अगर आती है तो इस इम्पैक्ट को हम किस तरह से थोड़ा न्यूट्रलाइज कर सकते हैं या कम कर सकते हैं?
बहुत इम्पोर्टेंट बात आपने कही है और मैं सोच भी रहा था टच करूंगा. थैंक यू फॉर टचिंग दिस पॉइंट. और दोनों बातें, एक तो नेचर डेफिसिट डिसऑर्डर जो फर्स्ट लॉकडाउन जो लंबा वाला था, और इसके साथ साथ फियर की वजह से जो साइको डेवलप हुआ था सेकेंड वेव में. क्योंकि सेकेंड वेव में तो यही नहीं समझ में आ रहा था कौन बचेगा कौन जाएगा. आई माई सेल्फ रिकॉल द सिचुएशन कि मेरी टीम जो है, मेरी टीम 12-15 लोगों की है. विजय साहब आए थे तो कुछ लोग उनको मिले भी थे. उनके घर में अब किसी की मदर को कोविड हो गया, किसी को ऑक्सीजन नहीं मिल रहा है. उस समय तो आप सिचुएशंस देख रहे हैं. तो एक बहुत ही साइकोलॉजिकल प्रेशर था, और बच्चों में तो बहुत था क्योंकि वो खेलने नहीं निकल पा रहे थे. लेकिन ये लेसन अब निकल के आया है कि आने वाले समय में कुछ तरीका ऐसा निकालना पड़ेगा. और कुछ ऐसे स्टडीज भी आ गई हैं कि कुछ सोसाइटीज ने, कुछ कॉलोनीज ने ऐसे कुछ गेम्स ढूंढे जहां पे डिस्टेंस से खेल सकते थे, जिसमें आप टच ना करें. तो कहीं ना कहीं उनका जो एक वेंट आउट करने का तरीका है, तो मुझे लगता है कि इस तरह की भी कुछ डॉक्यूमेंट अगर की जाएं कि जहां पे लोगों ने इस तरह से काम किया कि हम, जैसे मैं अपनी उसका ही बताऊं कि जब हम सेंट्रल मिनिस्ट्रियल टीम में गए तो मैं वहां पे शायद 18-19 दिन था. 3 दिन तक हम लोगों ने मास्क नहीं उतारे एक दूसरे के सामने, रूम से मास्क निकाल के और मास्क के ऊपर वो शीट.
Namaskar and good evening to all. Thank you, Vijay Rao ji. So, as a chair, I have a responsibility to summarize it. But both the speakers and this entire session was so interesting, and there are so many things that I can actually keep you sitting here for 1 hour or more. But I will do all justice with you all. So, what actually I have learned from this, and what we all should carry as a take-home message is, how do we turn disasters into opportunity? That is something which is a bottom line which has come from this. हम लोग बोलते हैं आपदा में अवसर. ये अवसर नहीं, मौका है. मौका ताकि आप मजबूत इरादे ले सकें और मजबूती से उन इरादों के लिए काम करें, और इस तरह से काम करें कि वो मुट्ठी भर लोगों का भला ना करें, या मुट्ठी भर लोगों के पास वो मौके ना रहें. वो पूरे समाज के लिए, चाहे आप देश बोलें या पूरा विश्व बोलें, पूरे समाज के लिए वो यूजफुल रहें. So, जो मनोज जी का जो presentation था, this was actually a wonderful example for that. He has talked to us, how a volunteer group can be transformed into a city movement. And Pune, platform for COVID response, that is an excellent example wherein he talked about integration of so many organizations, right from corporate to government offices, and how do you convert that integration into an interface which can behave as a front end to serve people, so that it is just not about health essentials. Rather, it is more about how do you touch people and communicate them by movement, by transferring them, or by providing those services to all those. So I can only wish that PPCR gets more strength, more blessing of Almighty. And when we all are sitting over here, those who are concerned with disaster, we should always find out ways how do we get connected with you, so that we just don't take benefit out of such kind of platforms. Rather, from our own experiences, we try to build it on. We bring it from Pune to Meerut to Srinagar, a pan-India kind of, movement should be there. So that what he was talking about, this integration got a multiplier effect. This multiplier effect was in a very local conditions, but we should visualize how such type of examples can get converted into institutional arrangement so that entire country and world can take benefit out of this. So we heard, some of very glaring numbers like beds from 4,000 to 34,000, ventilators from 300 to 1,600 plus. So these are quantitative examples which actually show what a wonderful work you have done. So with your very kind permission, we would like to use it as a case study because we offer master's degree in disaster studies and also PhD degree in disaster studies. We would see opportunity how we can bring you to interact with our students, though our present batch is taking benefit of this. But we do have a coursework on, epidemiology. Though I see this is
मंच पर उपस्थित माननीय डॉक्टर एम सुंदर जी, मित्रवर्य महेश जी एवं सभागार में उपस्थित सभी भाइयों तथा बहनों, सुबह से शुरू हुआ सेशन और 4 बजे तक का समय था, अभी 4:15 बज गए हैं, तो मुझे बहुत खींचना नहीं चाहिए, ये तो निश्चित है। फिर भी पुणे के लोगों की विशेषता है, वो फोकट में किसी को खाना नहीं देते, इसलिए उन्होंने जो काम बताया उतना संक्षेप में काम करूंगा। नेशनल कॉन्फ्रेंस ऑन डिजास्टर मैनेजमेंट, रिजिलेंट मेथोडोलॉजीज फॉर पैंडेमिक, इस विषय पर एक कॉन्फ्रेंस करना और केयर जैसा एक रिसर्च बुकलेट स्पार्क ने प्रकाशित किया, उसलिए स्पार्क के सभी टीम का मैं हार्दिक अभिनंदन करना चाहता हूं। उसी प्रकार जन कल्याण समिति एवं जेएनयू के डिजास्टर मैनेजमेंट डिपार्टमेंट में इसको प्रोत्साहित करने के लिए इस प्रकार का कॉन्फ्रेंस का आयोजन किया, इसलिए इन दोनों का भी अभिनंदन। कोरोना के दरमियान गुलजार की एक कविता आई थी, उसमें गुलजार कहते हैं कि कभी ऐसा ना सोचा था कि जिंदा रहने के लिए आदमी कमाना छोड़ देगा, और कोविड ने जीवन के न्यू नॉर्मल्स ये प्रस्थापित किए। अनिल गुप्ता जी के मंतव्य में उसके अनेक
This conference has been concluded, and outside the participants may collect their certificates